Rhode Islanders are getting an additional 500,000 COVID-19 test kits, and starting tomorrow, the majority of those will make their way directly to cities and towns for distribution.
Meanwhile, the state is now searching for a permanent replacement for Health Director Dr. Nicole Alexander Scott, while a familiar face, Medical Director Dr. Jim McDonald, takes on the role in an interim capacity. 12 News anchor Kim Kalunian interviewed McDonald live on the air today for the first time in his new position. She joins us now with what he had to say about leading the department in a time of crisis. Kim?
Well, McDonald is being careful what he says about accepting the director's position permanently, telling me today he is evaluating the best way that he can continue to serve the people of Rhode Island.
You know, it's about serving other people. It's about the noble task of public health.
In his first television interview since assuming the role of interim director, Dr. Jim McDonald would not say if he's interested in taking on the position permanently.
My role right now is to help the governor find a permanent director. And really, that's what I'm trying to do. And really, when you think about what my personal career looks like, what I'm about is state service. I'm really just trying to serve the people of Rhode Island. And I just need to evaluate what's the best way for Dr. Jim McDonald to do that? Because I already have a pretty substantial role in the Department of Health. So let's see how this goes together.
Governor McKee had previously announced a team of healthcare providers to help him find a new health department director following the resignation of Dr. Nicole Alexander Scott. On Thursday, he named a smaller team to help with the transition, including McDonald, as well as Anna Noves, Assistant Secretary of EOHHS, Ernie Almonte, the Lieutenant Governor's Chief of Staff, and Chris Abulame, McKee's Deputy Chief of Staff. The nominee to succeed Alexander Scott will eventually need to be confirmed by the Senate, and in an email, Senate leadership says they're looking for 3 key factors: someone who's pandemic tested, opioid focused, and equitable.
Carrying the COVID-19 virus.
In the meantime, McDonald says it's his priority to get more Rhode Islanders boosted, since only 36% have gotten the additional shot to date.
Yeah, we're past the peak of the Omicron surge and we're heading in a really good direction. I think we're heading stable. It's hard to predict if we're not going to have another peak because there's a lot of letters left in the Greek alphabet. We could get another variant, so that we have to be careful about. We need to not just get through this Omicron part of this, but we need to prepare for what could happen next year and next fall and throughout the summer. So we just really need to get everybody boosted.
And Senate leaders are also putting out a public survey asking questions like, should the next director be from Rhode Island? They hope to have a new permanent director in place by the end of the legislative session. I'm Kim Kalunian, 12 News.